919 FM, your morning of impact. Sam Marshall shares uplifting stories and conversations with people making Johannesburg and the world a better place.
We continue those conversations here on 919 FM on the Social Impact Show with me, Sam Marshall. Yesterday was World AIDS Day, and as you know, I promised that we would have conversations with really smart people that really know what they're talking about. And we'll unpack, of course, what World AIDS Day really means in 2025. So much has happened this year, and I thought it would be prudent to have this conversation. In studio with me is Ms Tata, who is the National Programs Manager at Shout It Now, one of South Africa's most innovative youth-focused organizations working at the intersection of HIV prevention, technology, and community health. Now, as the world reflects on the global theme of overcoming disruption, transforming the AIDS response, South Africa stands at a critical yet hopeful moment. We still carry the largest HIV burden globally, but we also run the world's biggest HIV treatment programs. And the country is nearing the global 95 targets, now estimated to be at 95, 79, and 93. Okay. Noma, thank you very much for joining me.
Hi, Sam. Ms Nomaxabiso Tata. Lovely to meet you.
Yeah, I wanna have a chat to you about, maybe before we talk about the global theme, talk to me a little bit more about Shout It Now.
So Shout It Now is an NPO. We currently have a footprint in Gauteng and in Northwest, and it's an NPO that was established in 2017.
Yes.
And the key focus around Shout It Now is youth health. So we believe in a world where youth are able to make the best choices for their health, able to have agency, self-determined, but having the information to be able to make those decisions.
And, you know, I love what you're saying about having access to information, but also we know that information is coming from everywhere. We live in a world of now misinformation, disinformation, and I want to get a sense from you. How has it become easier, or is it more challenging to get the right information to that young person that needs that information?
I think when we talk about information and communication in general, right, it's about when we share the message, how do we also receive the message? And with the message that we share, how do we make sure that it has impact and as well as resonates? So we cannot do that without the youth also at the center of everything that we do around the messaging. So we have to understand from their perspective, what is it that they would like? How would they like to receive information? But what are they also keen to find out about? What are they curious about?
What are they curious about, by the way?
They're curious about sex. They're curious about their bodies. They're curious about life in general, economic status. They're curious about whether or not, how do they become and have a career. They are curious about their parents, livelihoods, the society, pollution. So there's numerous things that young people are engaged in and they want to find out about. But our focus is health, right? And when we talk about health, we also want to make sure that we make it easy. Like you share, everything is there. All of the information is there. But how do we make sure that we also decipher the correct information, the correct facts? But also, when you then have the facts, what do you do with them? And that's where we come in.
And that's very important. Once you have the access to information, you've got the facts, what do you do with them? Now, there was this moment in history, and I'd love to be corrected by you around this. There was this moment in history where we heard that some of the people that are really impacted by HIV, they are becoming younger and younger. We currently have, I think, was it 1 million young people? What does it look like on the ground? Where you guys are working in, the spaces you're working in?
You know, the question that you ask is so important because you speak about the global theme around HIV response, right? Which is to overcome disruptions. But the South African theme is to renew efforts and to ensure that there is sustainability in the response. And that is very important because we are at a period where there is new infections, especially around youth, especially around the ages of 10 to 15. Wow. Now, definitely, that is not young people, adolescents that are consenting to sex. So it also brings us to say, what is the world around consensual sex, around gender-based violence, around the recourse also of making sure that we safeguard the livelihoods of young people. So when we talk about the new infections, it's so important that as much as we talk about the young people being infected, but who is infecting the young people? Who is infecting the adolescents? Is the agency there? And what is it that we can do that has a renewed focus as we sit in this global pandemic, but also the South African pandemic of gender-based violence? Because that is also something that is really driving the new infections.
Nomaxabiso, when you say that, it says to me that the guys around the, and I don't mean this in a negative term, but it means to me that you guys are becoming smarter. I think we used to think that HIV/AIDS or the transmission of HIV/AIDS or the virus was that it was for the longest part between two consensual adults. And now we are talking about all these other potential role players in the space, like gender-based violence. Who are the people that are infecting these young people? But as you go down this rabbit hole, do we have the kind of resources to start addressing these other things? Because we live in a country where only fairly recently GBV has been declared a national disaster, and it's been happening for years. And now you're bringing a very layered elements to a conversation that's already that has a lot on the table. How, as an organization, do you deal with these additional questions, because there are implications to the questions you're asking?
I think to compartmentalize your question into two. There's the first question that you speak about, the resources. And I think that we cannot take away that this conversation right here, right now, is a resource. So when we start the conversations,
that's a lovely way of looking at it,
when we start to actually dialogue, we actually are able to open not just a Pandora's box, but also a box of solutions. Because the information that you drive through this platform that you have also allows people to say, actually, I thought that this is something that is there. But right now, it brings it home, right?
You know, a lot of people think we're solving the HIV problem.
You see, and that's why you say then, how do I participate?
Okay.
In the space that I'm in, how do I change my demeanor around understanding that when one is living with HIV, how do I make sure that that person is still safe, that I do not stigmatize, that I do not discriminate? And it starts with us having that dialogue. So I think that we as much as the funding is important, as much as resources are important to build healthcare facilities, but having these conversations is also a very important resource. You also speak then about what then do we do in the different spaces that we're in, and looking at also our impact to say, how do we bring in these solutions? So part of what we engage in is Shouted Now is the understanding that this young person lives in a society. They are an extension of the society, and they are an island. Exactly, and and we know that the society is quite diverse, right? It's a microcosm of different activities, and when we then impart all of this information, how do we ensure that the mother, the father, the uncles, the everyone, the gatekeepers within that society also has sufficient information so that we build a safe environment? Because building a safe environment is not only with imparting Sam with information, because what then does Sam do with this after? And everyone else does not understand. So it's systematic issues that we also have to look into.
Yeah. And it's so true. And that's why I genuinely believe that organizations like yourself, you just seem to really understand that, you know, there was a time in the social impact in landscape, we would empower the woman and not realize that she has to go back into the same system.
True.
And what you're doing is you're creating conflict between this newly empowered person and the structure that she's going to, because the people at home, they have not been empowered. They don't have access to information. So I really love this. But this also then speaks to, I think, your dreams program, right? Which is now, it's busy concluding, or it has concluded after 6 years. That was PEPFAR funded. What were the lessons that learned? Because you impacted over 1 million people, 1 million young people.
Yes. So PEPFAR through Dreams. Dreams is a program that ran for 10 years in the country. Yeah. Shouted Now had the privilege of facilitating and driving this program for the 6 years out of the 10. And what's important as a key lesson around Dreams is that human beings were holistic beings. So Dreams did not look at just one aspect of health, but also looked at the social determinants of health, such as the economic landscape. How do you make sure that you provide the social behavior change programs? How do you make sure that you also involve the gatekeepers? How do you make sure that you also provide people the opportunity to be custodians within their communities? I think that is a very important lesson, because what we have seen with the decline of funding is that once I have the information as a person within the community, I can also then continue with that change. The lessons that I've learned, the skills that I've learned, I can be able to still reinforce them within my community, because these are our South African communities. This is where we know that there is an opportunity of growth, there is an opportunity of development, and if we are healthy, there is so much that we can achieve as a country.
I asked this question a little bit earlier in my interview with TB HIV care, and I want to ask you too: are we winning the war?
So it's important to know that with the decline in funding, that definitely
it was immediate almost.
Exactly, it was a screeching halt, and that means that there is going to be some loss of the gains. So how do we safeguard that? How do we make sure that with everything that we've learned, we are able to still take it forward? I think we are quite privileged that we have a country that is serious about dealing with HIV. But one of the things that we need to look at and consider very sharply is the issue around prevention. It does not assist that we have the highest disease burden, the most people on treatment, but even as you read the second 95, you can see that it being at 76% rather is really still a challenge, because you want to make sure that everyone that has tested then does get virally suppressed, right? And also then gets on treatment, because that also assists us to really feed into the prevention mechanism. With the introduction of new technologies and the advance of medicine, such as lenacapavir, that does assist us also to say, how do we then make sure that there is access to new medical mechanisms that can assist people to remain negative? Because we also know that the prevention is definitely better than cure.
Yeah, and I think as you have that conversation at the same time, you then need to make sure that one of the things, especially on the African continent, is that we pay more than most countries for having access to medicines. And so to your point yet again is that it's something that needs to be holistically tackled. So it's not just about, yes, there are these interventions, but are they affordable? Can people afford them? I can only imagine how difficult it must be to navigate 2025, because you're having a new set of challenges you didn't have in 2024. One of them being one of the biggest donor countries in the world have decided that they will no longer fund, and that is probably for the foreseeable future. It might change after this person vacates the current space, but for right now, for the next 3 years, you're going to have to be innovative. And it brings me to my final question. Talk to me about I think there's a self-cav AI companion.
Yes.
And I think that's, yet again, proves where innovation, to your point, even this conversation is a resource.
Yes. So I like what you say around the challenges that present, but also the opportunities that present. So when we talk about access, when we talk about the economic divide around Africa, the disparities, it is important that we also start building for ourselves. We also start to champion change. And that is exactly what we've done with Ordere, as shouted now, where we were able to say, how do we partner with organizations that already understand the AI space, the technology space, and build tools that can also advance what young people need. So Self-Love is a chatbot that is on BeWise. BeWise is the Department of Health, the National Department of Health platform. It is a chatbot that you can engage in, that you can get information in, that you can be able to find a space where you can have a full conversation around multiple topics of youth health, and you can be in a space that has no stigma, that also speaks to you. So there is a companion that engages you. It is an AI tool that is able to provide you factual information. It's also able to provide you information in the persona that you like. So what is important about that is that what then makes you feel more safe in order to then have that engagement. And that is quite important to us to say, how do we then co-create these tools that can also then assist young people with their language, with their own understanding, that can drive those health conversations.
One of the things that came out very strongly as we wrap our conversation, I just wanted your thoughts on it, and maybe a way this year for us to get South Africans, because I think all of us at some point, Nomaxabiso, is that we are family, friends, we are partners, we are in groups. It's not as if people that have the virus are on their own in an island. But one of the things that came very strongly through TB HIV care is that even in 2025, stigma is still one of the biggest reasons why people don't go, why they don't get tested, why there's over 1 million people walking around not part of a program. How can we get just ordinary people to understand that you are not helping the person if you are stigmatizing them? You're just not helping them. That it doesn't help, because it's similar to cancer. It's not one person that's going through it. If you're part of a family, the whole family is going through that process. So how can we get rid of stigma?
I think in unpacking stigma, we also have to then also understand where does it come from, right?
Yeah.
So there is a lot of issues around fears, right?
Yeah.
As you've shared, we currently live in a space where there is young people that are born or were born with HIV that have never engaged in sex.
They don't even know about it.
Exactly.
Because their parents have been giving them tablets.
And that is also maybe because of the fears that the parents also have. So as we normalize having these conversations, it also is very important that we then are able to simplify the messaging around what does even having HIV mean. We come from an era where...
Because it's not what it was 15, 20 years ago, right?
Exactly. And what Dr. Aaron Mutwaledi shared yesterday at the National AIDS Day is that we've been having this for 44 years. And we definitely need to change the mindset. But also, what does changing the mindset encompass, right? So when you've moved from an era of taking multiple pills to having just one pill, and access to that medication where you don't have to wait for your CD4 count to be at a certain. So those conversations are conversations we need to continue having, because that also assists us. The more we get to have a deeper understanding, we get to then destigmatize, we get to lessen the judgment. It's very important that we normalize conversations also around sex and the harms, and also issues around consent, alcohol abuse, because when we understand that all of these things may drive the risks higher, then we also get to understand how do we safeguard the community as a whole. What is my part in safeguarding the community?
I love that. Where can people find out more about Shout It Now?
So I'll start with self-gov because I know that our time is limited. So self-gov, anyone can engage with self-gov on 087 373 1548. It is on a WhatsApp.
Yeah.
Yes, it is on WhatsApp. You save it, you then say hi, and you continue engaging. We can find Shout It Now on all the socials, Instagram, TikTok, Facebook, Shout It Now, and you're really free to engage with us. We're really engaging even on those platforms, and we look forward to